The skin on the outer part of the ear canal has special glands that produce earwax, also known as cerumen. Earwax is helpful in normal amounts and serves to protect the ear from damage and infection. At times, however, too much earwax may accumulate, and it may become too difficult to wash away naturally. This can lead to earwax or cerumen impaction, which is one of the most common causes of hearing loss. There is no way to know if you have excessive earwax without having a doctor look into your ears. Earwax removal is performed safely and easily in the doctor's office with special instruments to avoid eardrum injury. If the earwax is too hard or impacted, your doctor may prescribe medicated drops to loosen the wax.